Your Excellency, fellow members of the board, dignitaries, AUN faculty, staff, and above all, students. Recent events have put health in West Africa at the forefront of world news. Unfortunately, the media scare techniques have reinforced misperceptions of Africa as the home of downtrodden and poverty-stricken people who have only problems to offer to the rest of the world. To those of us who know and love the continent and its people, these prejudgments are ludicrous. Events such as the Ebola epidemic reinforce these negative images. There is little coverage, for example, of how well Nigeria, as the result of a strong and vibrant public health tradition, knew what to do and did it quickly. Currently, there are no known active cases in this large, complex, and beautiful country. I cannot say that about the United States. As I reflect on the issues of Health and Development University, I'm reminded of an incident early in my career. As a young professor of public health, I was assigned by the Pan American Health Organization to work in the country of Bolivia, South America. At the time, there was a serious outbreak of cholera in Bolivia, which made every headline in the United States and provided the same kind of scare message that we see with the Ebola outbreak. Cholera is a disease similar to Ebola in many of the treatment and prevention protocols. After reading the headlines, I of course was panic-stricken at the thought of going into a cholera endemic area, and along with my mother was convinced that this was to be my last trip. At the time, my senior director was the esteemed chairman of Tulane's Tropical Medicine Department, Dr. Paul Beaver. I managed to get up the courage to get an appointment with him so I could discuss my impending demise from cholera in the jungles of South America. We went to lunch at a local hotel, and at the end of the lunch, I asked Dr. Beaver how I should protect myself against cholera in these terrible conditions into which I was going. Dr. Beaver smiled and said, "Bill, wear a tie." I sat for a few moments puzzled at what a tie would have to do with cholera. And while I didn't say anything because I didn't want to appear stupid, at the end of coffee, Dr. Beaver turned to me and said, "Are you wondering why it is that I told you to wear a tie?" I said, "Yes, sir, but I was afraid that I should know." And he said, "Yes, you should know." He said, "If you're wealthy enough to be accustomed to wearing a tie, you're probably going to be healthy enough to withstand cholera, should you get it, and get good care if you have it. The result is that your risk is relatively low of anything serious happening with cholera, considerably lower than riding your bicycle to work this morning. In short, if a society is well educated, has good preventive and curative primary health care, and is prepared to move quickly, as Nigeria has done to contain a deadly virus, the risk is relatively low. So what are the core elements that go into creating an environment that will fight off an epidemic, encourage better health for all of the people? The World Health Organization defines health as a state of complete physical, mental, social, and well-being, and not merely the absence of disease or infirmity. I will touch on several areas which I believe to be the most important in fighting disease and in promoting good health. These areas of action are, in my mind, the core requirements of a development university. The first is a broad area which we have come to call individual human security. It has two parts. The first and most tangible aspect of human security, which we face every day, is access to adequate food and clean water. Without sufficient nourishment and adequate water, humans cannot exist. Through the hard work of science and technology brought to us primarily by universities, the Earth now supports the creation of enough calories for the entire population. This is a remarkable feat, since starvation was a normal occurrence in all parts of the world 100 years ago, even during the Great Depression in the United States in the early 1900s. Now, with almost 6 times the total number of persons in the world as in 1914, there are adequate calories produced to feed the entire world population of 7.2 billion people. This increased productivity is a direct result of the Green Revolution, driven by primarily American research universities. It is a strong argument for developing a university in Nigeria based upon the American model. There is still a world and a Nigerian problem, a distribution issue, leading us to issues of equity and development. According to Professor Onimawa of the Nigerian Nutrition Association, malnutrition contributes to 60% of the underlying causes of avoidable death in Nigeria. giving the country one of the world's worst maternal and infant morbidity and mortality rates. There is no unresolvable reason for starvation in Nigeria today. Food security is at the core of the solvable health problems. It is the single most important intervention in public health that can be achieved with political will and focus. Sustainable agriculture and social and economic development is the known response for improving nutritional outcomes. We know how to do this. A second component of the security epidemic is one we are faced with in Yola today: massive forced internal migration. This migration creates multiple human problems, including malnutrition and resultant poor health caused by physical insecurity. People need to be and feel secure in order to carry out their normal functions of their daily lives. The issue of physical security is inadequately researched outside the area of warfighting. AUN has begun to focus on human security as an important element at a development university, and the adoption of the Chibok girls as part of their educational program shows that they are improving lives through improving education. The core value in improving basic human rights to security is a stable and enforced rule of law based on human rights paradigm. The title of law and the protection of rights of all are the basic tenets of the human rights movement, which is closely linked to achieving the equal treatment of all citizens. This is a core value of all American universities, to which AUN strongly subscribes. AUN embraces and reinforces these values that foster security. It provides a model security force for the region. It equips them to embrace the students, to embrace human security as a concept. The university is moving towards developing a law program to reinforce the importance of the rule of law in development. This will assist work for all aspects of peace and security through promoting sustainable development, which is the mandate of the university. If we look at how we have conquered the great diseases of the world, such as smallpox, polio, and measles, it is almost always through research breakthroughs, which have sprung fruit from the world's great research universities. These technological and scientific breakthroughs are what have been responsible for expanding the life expectancy of the average human. AUN is increasing its emphasis on applied development-related research. A shining example of this are the posters reporting the research from Prof. Matthias Fonkum Seniors in the School of Information Technology and Computing. In the single area that is driving all of science and technology, computing sciences, AUN is a Nigerian leader, and we soon hope will be a world leader in undertaking important applied research oriented towards the community. I suggest that you review some of the projects of his students on the posters in the hall. The most single important proven and researched intervention to promote health and development is through universal education of the young. To move even faster along the path of development, a focus of the education on young women and of young women is the proven path. Educated women tend to have fewer children and take better care of the children that they do have. As a result, society has a higher quality of human capital at every level. The quality of life improves for all. The single most important intervention for health is therefore early childhood female education. This should be and must be the priority for Nigeria to improve health. AUN has a strong contribution to the role of good management in solving problems of public health. I quote a Nigerian professor to summarize how Development University can impact the health of all Nigerians. The increase in life expectancy in the Western nations is now in Europe well above 80 years. In Nigeria, it's 52 years. The issues that could result from simple measures such as improved standards of hygiene, sanitary engineering, better nutrition, safe drinking water, and steps to improve infectious disease can make up that difference of 30 years between 52 years that we now enjoy and the 80 years that some of the Western countries have. There is no reason that this cannot be done. The science and technologies involved in these improvements have been public knowledge for decades and are not beyond the capability of Nigeria, as proven in the control of Ebola. Effective implementation of these preventive public health measures in Nigeria is obligatory for the elimination of needless premature deaths. The only barrier to implementing the required public health measures are those that we have erected ourselves. AUN, through its School of Business and most recently the creation of the Atiku Center for Leadership, Entrepreneurship, and Development, is focusing on those management and implementation issues that will bring health to Nigeria. We know the solutions to add 30 years to the Nigerian lifespan. Imagine the human capital represented by increasing the productive life of every citizen of this country by over 40% for the largest nation in Africa. We simply need the leadership and entrepreneurship required to implement solutions. The Atiko Center is a large step in making this happen. As I reviewed the accomplishment of the last 5 years of my involvement at the American University of Nigeria, I was impressed at how elements of the university had expanded into the community, recognizing the importance of early childhood education and involving students, faculty, and administrators in the crucial task of understanding and changing primary education. AUN, as a development university, strives to educate from the cradle up. It provides an example of total community involvement. A partial list of these accomplishments include community education in information technology and entrepreneurship to over 4,000 vulnerable youth, the AUN students serving as teachers' aides to underserved primary school populations, the AUN campus used for community functions and activities, particularly in the Peace Through Sports program, AUN serving as the hub for the Grand Alliance of local entrepreneurs with a focus on starting new business and other activities, AUN taking a major role in aiding with the internally displaced persons and refugees, the AUN faculty and staff focusing on real Nigerian problems and coming up with innovative solutions as demonstrated by Prof. Funkum's senior research projects. There are many other activities, but perhaps the most important contribution to human security at this time is the formation by the former Chairman Joda of the AUN Board and President Enzyme of the Adamawa Peace Initiative over 2 years ago as a forum for resolving differences and preventing conflict. I had the honor and pleasure of assisting in the production of a monograph which documented the participation of AUN students from privileged backgrounds, many, helping educate the poorest and least resourced children around the university. It was wondrous to see the impact of the community involvement on the children, and equally impressive was the impact of the children on our AUN students. In summary, let me focus on how AUN has helped all of us to define the role of a development university by doing it rather than thinking about it, and thus becoming a center for leading Nigeria towards a path to better health through education and development. AUN is focused on training and educating the young with a particular emphasis on young women. This is the fastest route to health and the fastest route to development. They have done this by committing the services of faculty and students at all levels of education and by standing behind the community under stressful times. They are attacking the core causes of poor health and trying to enable the population to take care of themselves. They're looking into the expansion into public health and medicine to augment their role as improving the security of the people they serve. AUN, in moving quickly into a position of importance in all aspects of development in Yola and Adamawa, reminds me of a story I recently heard about a fire engine in Port Harcourt. I come from Louisiana where they have oil field fires fairly regularly, and there was this big oil field fire down near Port Harcourt, and the terrible fire brought out the local fire crew and their fire engine. And the fire engine raced toward the fire and suddenly sprayed water on the engine and sprayed water on the firemen and sprayed water on the engine and sprayed water on the firemen, and got closer and closer and closer to the fire, and it was hot and it was terrible and it was burning, and they kept spraying water. And finally they got to the fire and they put the fire out. Well, the Shell executive who owned the oil rig couldn't believe that they were able to do this. And so he had a banquet in which he gave them an award. And he said, "It was incredible what you gentlemen did. We've never seen anything like that." So the chief of the fire department, the man who drove the truck, got up and he said, "Thank you, sir. We appreciate the money. And the first thing we're going to do with that money is buy brakes for our fire truck." Getting to the fire was a matter of urgency because they had no other choice. In some ways, AUN reminds me of that fire truck, rushing to help solve community problems without brakes at work. Perhaps a good thing when you see the problems have had to attack in an emergency mode. I feel honored to have had the opportunity to learn from AUN what a development university is, not by reading learned academic texts in the Oxford tradition, but by action for the community in the Nigerian context. I only hope that we can continue to grow that vision to give access to more students who seek a first-rate educational experience. In the context of YOLA, I believe that AUN stands up to what might be considered an emerging view of health, which encompasses a new vision for human security. In a recent newspaper interview, our founder was asked what was needed to solve the serious problem of insecurity in Nigeria. He responded that a lack of political will to tackle insecurity issues holistically was at the root of current problems. I present to you that through his stewardship and unselfish giving to the American University of Nigeria, he is defining the holistic view of human security and health for Nigeria. On this, the 10th birthday of AUN's founding, with current inspired leadership of a short lady from the United States, there is a collective force of nature that focuses on education for AUN students, staff, and faculty. Education for all members of the community, and ultimately education and resultant better health for Nigeria and Africa. We are all honored to be part of the magnificent effort so crucial in this vital time for this important country. Let us not put brakes on this fire engine of change. Thank you.